Very warm good afternoon to everybody. I'm Dr. Manshu on behalf of Jaipur Physiotherapist Network and Jaipur Rehab. I welcome you all for the celebration of World Physiotherapy Week. Uh, I just would like to invite you people for such a most awaited webinar of the day. That is about the postural correction and postural ergonomics taken by the most renowned speaker in the ergonomic industry, Dr. Sharmila Devi. I would like to introduce ma'am before all the participants of the day. Ma'am is a specialist in pediatric physiotherapy. Ma'am is also a specialist in neurodevelopmental therapy. Ma'am is currently working as a director at India Ergonomics Healthcare, and ma'am is also working as a physiotherapist at Pondicherry Cricket Sports Association. We welcome you, ma'am. The session is
Thank
all
you, sir.
yours. You can start.
Thank you, sir. Thank you, Jaipur Physiotherapy Network and Atul Singh sir, Himanshu sir, and everyone. I'm happy to be here with you all to share my topic, the posture ergonomics. You all may aware about ergonomics, and I'm here to share why I quote the title, what is posture ergonomics. Okay, I simply tell you what is ergonomics, which you all came to know earlier. Ergonomics means a fitting a job for a worker. Actually, previously it was there. Ergonomics is only for a worker who is seeking for, who is going for job at workplace. That will be set as a ergonomics, and then on that outdated ergonomics, what they do is they give preference to the environment initially. How to change this chair? How to change this? Wheel, how to change that pulley, and how we can modify the work setting, how to modify the entire lighting system, like that. Okay, so of course it is needed, but it is not the primary thing. But in case it will, that will be environment plays a role according to the workplace. Actually, true to say, it will depend on the workplace. In case it going for a corporate means, it will where to give the importance, that will be different, and where to give importance on the ergon. There are four concepts of ergonomics which I will be saying you. But in case of manufacturing or industrial side, if we are going means, the preference to give that will be different. So we cannot fully pledge into the environmental aspect only. So this is the outdated ergonomics, and in that ergonomics, people who are a physiotherapist who is willing to be as an ergonomist don't find the way, may find difficult to collaborate with the corporate. Actually, those things, those drawbacks, and there won't be a specific assessment chart, or they will be moving on with the rigid assessment form, like they will follow a rigid thing like OSHA or something. Rubal, many more things are there. Previously it was that much rigid, and they followed that own preventive measures, and those preventive measures is absolutely right, but it won't be appropriately suit for all sort of setup, like manufacturing, like country to country it will vary, actually, depending upon the machinery and depending upon the work style, living habitual food habit, everything it will vary, how they are traveling from home towards the job. So we cannot make an assessment only for workers, only at a work site. Because see, for example, if a person is there sitting in IT company all the way from 8 to 8, if a person is sitting in a chair, okay, so he didn't notice any knee pain. Okay, next day or some after day, when he is doing his toileting activity or squatting activity for his ADL, he feels a slight knee pain. Actually, the problem is not only that is, if we go only with the worksite assessment, if we skip the assessment of that particular individual who came for ergonomic assessment, there are too many difference are there. We can do ergonomic assessment for a whole setup. Okay, that is different. I will come again. Okay, so if a person, single person is coming to you and ask for ergonomic assessment, means regarding his job, telling his job history, like that. If he is having knee while doing squatting or doing using Indian toilet, like that, we cannot confine only with the workplace, that is his office job, because or ADL. Okay, what I'm trying to say is, if a person, the predisposing factor for that person for knee pain may vary from morning to evening. That is, if a person is squatting, means how he squat. That is, initially we will teach, even we many of a physiotherapists may teach, don't bend at the waist, okay, flex your knee and then make a squat. Actually this is absolutely right. And even as a physiotherapist, if we practice, if we perform a squatting without any hip or knee pain, without any risk factor for hip or knee pain, there might occurs a problem actually. What the mistake is, we should not initially flex the knee. Okay, we have to push our gluteus backside. Okay, and push our gluteus backside, and then we have to, when we have pushed our gluteus or pelvic backside completely, then we have to initiate the knee flexion. That too, that knee flexion till 30 degree of knee flexion won't hurt actually. It won't make that much compression to the knee joint. Okay, if they are going to a full squat, what happened, there has to be a slight of 10 degree or some 15 degree of ankle eversion, like that eversion has to be there. Okay, these small posture while performing this single squatting is important to prevent a knee hurt. Okay, while initiating, while they fully into a squat, okay, that knee should not go for the toes. Okay, consider this is a toe tip. Okay, that knee should not go flex away to the from the toe. Okay, this is important. If they are moving away to the toe, means certainly it will affect the back, and also the compensation of spine will happen, and the knee will hurt, and ankle. That too, in ankle we won't put same weight over two extremities. These are small issues actually. So we won't put a uneven, we will put uneven weight distribution. That's why the ankle sprain are more frequent, and that knee cartilage, wear and tear cartilage changes are happening, and these things are starting from the home. Okay, so this thing may person may squat either for his toileting activity, or to pick up any object from the floor, or anything for any purpose, to take a bucket like that for anything. And then a person is traveling through either through bus or any sort of vehicle to his office, means take bus. Indian bus staircase is very high. Okay, if they want to climb that staircase, means they have to produce more flexion, and over the one ankle you have to the toe, over the toe have to bear the weight first, and then weight transmission will be moving onto the heel of the foot over single extremity, so it will also hurt that knee. And also when they are getting again from the bus, means as the bus foot stair is very high, they have to jump down, so it also create a compression over knee. And if a person is going to a office setup, means he will be sitting all the way in the office. What they do is they will be keeping their knee flexed, and keep their leg underneath the chair. Okay, they will keep the hip 90-degree flexion, and knee more flexion underneath, and they keep the thing either leg at the crossed at the ankle. Okay, and they keep the knee like that underneath the chair. So what happens is this factor, that is the that knee flexion, which is they are maintaining all the way from the morning to evening in the office, may also contribute a factor. So he may not feel any sort of pain initially in his office environment. He will feel only in the home activity. So we should not confine our history only. We cannot define, or we cannot create a solution for a problem only if we assess workplace environment, or history only from the which we take from the office environment. Okay, so we have to move all the way. If we have to make a complete solution for that person, means we have to travel with that person all the way from the home activities, travel activities, and how they are bearing their weight bag like that thing, and how they are walking, whether they are while standing, whether they are putting pressure over both the hip or not. So all these factors we have to come across, and finally we have to rule out whether chair is appropriate, whether this thing. computer is appropriate, how much movement he is producing, how much roaming he is doing during his workplace time. So whether he is moving around his office or not, whether he is completely sitting, so like that many thing is there, and we have to ask the question whether he is awareness about his posture or not. Okay, so all these things, when we do all these things, we will get a solution and we will get a full recovery for that person, if we give go for a solution with it. So we cannot confine only with the workplace assessment or these things. Okay, so we have to move up apart from the workplace and to the home. Okay, so what I'm trying to say is this is a old type of ergonomics where we confine only the worker on the workplace. So, I have to give the new updated ergonomics is what I can say is it's a posture ergonomics, because all the way I said a story of one person. So all the way what you noted might note is I am always speaking about the posture and I am trying to give solution for the posture. So under ergonomics, even for chair, if we are giving preference for a chair, even if we give a well defined chair, ergonomic chair means that person have to know to how to utilize that chair. So everything deals about the posture of a person. Human priority first is an important thing in this updated ergonomics, that is on the posture ergonomics. So ergonomics is a fitting a job, of course it is a fitting a job for a worker. And what I'm adding to it is not only fitting a job for a worker, we have to fit all sort of activities for a worker, not only for a worker and for an individual, whether he or she is a housewife. Of course housewife job is a laborer's job. There is no way she can skip from the housework routine. She have to clean, she have to cook. That is a laborer's work. If a job is we cannot unavoidable, that is a laborer's activity. So of course household activity, housewife job, housewife activity who person woman who is doing, that is also a laborer's job. So we have to rule out under ergonomics, we have to cover all those things. And of course nowadays not only men are into work, of course women are doing work along with this half, there is half time household activities and half time a worker. Okay, environmental worker. So we have to cover the entire thing, and all the things that is under this posture ergonomics. We have to rule out the activities and the people, how to make fit the person for the activities, even a small activities which I said, like squatting, how to wipe the floor. Okay, so all these things, small activities, if that aggravates a pain, that is for ladies, for household women, if they are doing the mixing the any gravy or something with that abducted arm, it will, gravity is pulling like that, so it will create a shoulder pain. So we, this small activities we have to give importance. That is the updated ergonomics. Okay, that is, this ergonomics is not only meant for a office worker or a industrial worker or anywhere, even that all the workers start their work from the home. So we have to start the assessment and management from the home. For the home remedy, we have to rule out everything if we are giving appointment for a ergonomic patient. Okay, so clinical ergonomic is of many types. I come again to that point later on. So this is about ergonomics and posture. Posture, here I have to say, you might know posture is the alignment of a body segment, and we will be concerned about a sitting posture, standing posture. We will be assessing sitting posture, standing posture, and lying, either supine lying, prone lying, all these things. And what I am adding to this posture is if I am sitting, okay, even our body, another one more thing why put a posture ergonomics is most important thing is here, because, sorry, so our body, God created our body to design as a move. He designed our body as to move. Okay, each and every part of a body segment is moving. Heart is pumping, that intestine having peristaltic movement. So every musculoskeletal system is producing movement, and everywhere there is a contraction and relaxation. Even under the blood vessel, there is a smooth muscle contraction, relaxation is there. Of course, if that doesn't work, it creates a problem like atherosclerosis, and many more complications are there. Even in the venal system is there. So our body is created and meant to move. Okay, if we are not moving, it creates, that is will be said to as a sedentary lifestyle which we are following. Okay, and that is mainly leads to a improper posture, and that leads to a not musculoskeletal discomfort and strain and sprain. Not only it is not leading there, leaving a discomfort or injury to the musculoskeletal system, our organs which is underneath the musculoskeletal system, which is supported by the ligament, fascia, and muscle, which is also needed as support from the surrounding musculoskeletal structure, or going for a dysfunction because of this wasting and imbalance of a musculoskeletal system. So if we are dealing, wherever we are dealing assessment regarding posture, we should not concern about body as a whole. Okay, we have to see imbalance by a single muscle. Okay, onto a single joint. See, if I am sitting like this, I am speaking with you, all the way I am nodding my head and I am rotating my head like that, I am tilting my spine like this. So I'm doing a mobile lecture to you, doing a mobile movement. Even if I am sitting, even in this sitting, even if I am speaking with you neutrally, keeping my head without any gross movement, if you, even if you cannot see any gross movement in my body, in our joint segment, there occurs a slight movement. I am speaking means there occurs, if a person is sitting for 1 hour, means that spine goes for compression. Okay, that intervertebral disc imbibes that fluid outside, and it leads to spine compression. So muscle has to bear the weight. Simultaneously, if a muscle is bearing a weight of the head, it will along with it acting against the gravity, it will make a some sort of sliding and gliding movement over the individual intervertebral joint. It leads to, actually, that is intervertebral joint movement is producing. So if a person is having a weak musculature anywhere, if I am sitting like that constantly, means even if you cannot notice, even you may see my head line with the shoulder, this is a good posture. Even if I am seeking having this good posture, unknowingly there may occur a functional dysfunction over any of the individual joint segment in my neck. Okay, so we as I said earlier, when you are assessing posture, even if you're assessing a static posture, there is a chance for dynamic movement even under the static posture within the individual segment. So we have to look into that, whether that individual segment is hypermobile or hypomobile, which muscle is imbalanced or which muscle is compensating. Like that, we have to assess the whole entire thing, because even with a person with the good posture may have a strain or may develop a trigger over a trapezius. There may be any sort of even mild dysfunction, or even the problem may not over the shoulder or musculoskeletal system directly. The problem may be over the vestibular system or over the eye. That may affect secondarily the neck musculature or the shoulder musculature. I say you the example. For example, if a person is sitting, if a person is a IT job worker, okay, so he is all the way looking at this computer like that. Okay, so if the person is forgot to blink nowadays, blinking, that small action of blinking which we naturally do, also we are forgetting to blink. Actually, all the way I'm with you for along almost 10 minutes. Okay, you might not notice that I am blinking my eyes because I have to look constantly you. So I am staring. So what happened is it leads to a dryness of the eye. So there is aqueous humor is there. Okay, which will produce that fluid has to be, if only if that fluid is there, it will keep that lens at the appropriate size and appropriate length. Okay, so our lens is attached by means of extraocular muscles, and all ciliary muscles is there. Okay, everything is attaching, that is holding the lens. Only if the lens is an appropriate length, if we have a clear binocular vision. Okay, we can have a good accommodation, good convergent and divergent property and all, it will be good. Okay, if we are if that lens, if that thing dryness is happening, means because of constant staring over the any sort of television or system. Okay, so what happened is that production of that fluid will get reduced, so ultimately the lens, everything goes for tiredness, dryness. It will lead to imbalance in the musculature. One most important thing which I share you now is our extraocular muscle have a very good number of proprioceptors than the suboccipital muscle in our body. The suboccipital muscle, which is over underneath the head, having a more number of proprioceptor, that is the position sense. Next to that is the extraocular muscles. That extraocular muscles, the nerve which supplies that eye along with the suboccipital muscle, that is the nerve emerging out from the suboccipital muscle, and the vestibular nerve, everything travel in a single tract in the pontomedullary reticular formation, that in the of the brain stem. Okay, so if this eye strain, single eye strain, that is eye strain is otherwise called asthenophia. Actually, this asthenophia may leads to a nearsightedness. Okay, any refractive error problem. That is that how that happens is because of that improper thing, the lens shape also change, it leads to myopia or anything. Okay, so this is a problem. So because of these things, to some extent these extraocular muscle will compensate. So what happens is it will compensate by means of suboccipital muscle by pulling the neck forward anteriorly. Okay, so this suboccipital muscle will compensate. While compensating, it goes for overaction of suboccipital muscle or tightness. It leads to inhibition of the proprioceptor activity of the suboccipital muscle. So thereby a chain connection from the eye strain, it leads to a suboccipital tightness and imbalance over the brainstem muscle, brainstem neural inhibition. Like as such, in wasting of our musculoskeletal thing, there also a weakness and inactivity can found even in the brainstem or neural anyway. Okay, so this leads to those things inactivity, and we are unaware of going to what. However, if you strengthen our body, okay, strengthen the neck musculature, and if you are training and if you are trigger releasing anything, if you do, unless or anything, yes, brain is having a plasticity. It records all our posture and all for a long time. So another thing, as it goes for inactivity, pontomedullary reticular formation, as it went for inhibited action, it leads to it takes a lot and lot time to change, to adapt for that new environment. So we are with this forwarded posture and compensatory changes happening from the shoulder towards even to the plantar fascia. Fascia, that problem may occur as a plantar fasciitis even by because of the simple eye strain. Because for a single worker, that is a computer worker, because of this single eye strain problem occurring, happening by to the suboccipital muscle, and then to either anyway it may come and travel over the anterior spiral chain, or it can travel, or any sort of imbalance can occur in the posterior spiral chain, or anywhere it can happen, and leads to a whole musculoskeletal system a discomfort thing. So what I'm trying to say is, under this new posture ergonomic, okay, you have to deal all those things from the head to foot regarding the posture. If we deal all these things, we can give you can give a good ergonomic solution for a worker or an individual or any people. Okay, so all the way what I covered is this thing. I defined about the what is ergonomics and what is posture. So under posture, we should not confine over as either sitting posture, standing posture like that. Even under sitting posture, you have to see over the individual joint segment. Even while on gait, you have to see how they are keeping the neck, whether tilting, how that jaw clenching is there. So everything from head to foot we have to assess, and our eye have to scan everything as a whole. But along with that individual assessment of a even single joint, you have to keep a key point in our body. If this happens, this may be the thing. So we have to assess that, and we should not go with a guess, and we should find out the right imbalance, and then only we can give a solution. So all the way you have to see posture as an individual segment, whether either in a static or over the immovable thing like walking. So when we are joining this posture and ergonomics to the whole human, what are the component we can see under this posture ergonomics is there are four. First is, as I said, it is our body is designed to move. We have to see a functional component. First component of a posture ergonomics is a functional component, under which how we are moving our body segment. Okay, individual body segment, how is moving, either compensatory movement is happening or not, whether that person is sitting, whether that person is constantly sitting like this making a movement or not, how they are whether they have any dynamic walking like in between their work schedule or not, how much time the person is watching a TV, how is their work routine from the office work to the household work, what is the, how is the shift from the house to the working environment. So all these, all the way we have to look for a posture. Okay, so and not only posture, functional. Okay, so first we thing we have to see is a functional, how the transmission is happening, body movement is happening. Okay, first is a functional component, functional ergonomics, and second component of posture ergonomics is a posture component. So whether a person, how a person is moving, how while moving, how he is keeping even keeping his or her neck under the neck, how that individual C6, how is C6 C7 alignment is there, how atlas and head is atlas and head alignment is there. So like the small things we have to give preference, and we have to see as a whole posture. Okay, so this is the second component of postural ergonomics. First is a functional ergonomics, and second thing which I'm insisting now is a postural ergonomics, and third is a brain based ergonomics, which I said earlier with the example. This all our body posture, all our signal, even if we want to, even if we give proprioceptor training, where whatever we are giving, if there occurs a recurrent of same symptom again and again, maybe. Okay, so for some people, so what the problem is, they might have missed the component of brain based ergonomics or neuro ergonomics or brain ergonomics, whatever we can say. But cognitive ergonomics is different, something different when I'm speaking regarding this thing, musculoskeletal and posture. Of course cognitive is related with the posture, and that is a complete drastic thing is there to speak. If we see a relation between a posture and cognition, that is a vital information is there. It will take a long time and separate class. Okay, so I'm relating our brain one along with this posture. Okay, so here I have to say, like to say you, our brain. Okay, so there is a homunculus is there, HOMO, homunculus is there. Okay, that is body representation as a figure. Even in the motor homunculus is there in frontal, and a sensory homunculus in parietal lobe. Okay, so and all the way, so a frontal lobe is for motor execution, and sensory gives stimulus to the motor thing, and occipital lobe for vision, everything, and temporal lobe for hearing, and many more accessory thing is there. Okay, and if you're coming on to the brainstem, it has a main role in maintaining a posture. I say you with simple example. Okay, so if a person, see, I give you two example. So if a person is coming with a right hand weakness, if a person is having a right hand weakness and they have a movement dysfunction, they cannot move about the 90 degree of shoulder abduction, means it not only affect the shoulder, but also for the right shoulder, the representation of that right shoulder is in left homunculus. Okay, left motor homunculus and left sensory homunculus. Sensation if it's affecting means sensory, that thing is in sensory homunculus. So for the right dysfunction, it will affect the left motor homunculus. Only if we activate this left motor homunculus, we will get a good recovery and we will get a good full range of motion, and will there won't occurs a recurrent sort of pain or dysfunction again, because we have to create awareness, we have to change that thing, we have to give good sensory input to the thing, we have to like if a person want to free from musculature, any sort of musculoskeletal dysfunction imbalance mean, we have to activate the muscle first before going for strengthening. Okay, before going for undue strengthening, vigorous resistance training and all, we have to activate first, same like that, in order to get a full range of motion along with the good solution. You have to activate the left motor homunculus along with the right motor homunculus, sorry, left sensory and motor homunculus, we have to activate that. Okay, then only we can get a good solution. So, and another example which I give you is a see which I said pontomedullary reticular formation. That medullary reticular formation, which I said, eye and this vestibular and that suboccipital muscle, everything traveling over that pontomedullary reticular formation, which I said. So that has a major role in preventing that flexor dominant posture. Many people are doing with this flexor dominant posture means it affect that the pontomedullary reticular formation system. Okay, so that is the main structure which will inhibit that flexor dominant. Along this brain stem, okay, the midbrain pons and this middle have a connection with the cerebellum too. Okay, that cerebellum as give a extensor tone, maintain the extensor tone against the gravity. Only if that pontomedullary reticular system along with the cerebellum is efficiently functioning, we can be maintain a good posture. Okay, we can fight against the gravity. So if any of the problem happens, even a slight sort of dysfunction, see, if a person is keeping like that means cerebellum is overacting and pontomedullary reticular system is inhibited. So if we want to correct this posture, okay, without any recurrence, and we want to create awareness for a person about his or her posture means, it is not only necessary to activate the proprioceptors. Okay, we have to activate the we have to activate that individual the thing cerebellum. Okay, so this is what about the brain based ergonomics or neuroergonomics. And then the thing is the environmental aspect. If we, and that fourth is the environmental component of posture ergonomics. Under that environmental component, we have, before we look into see for IT companies and all, if you're going for IT company, there are many type as an ergonomist we can deal with IT companies. Okay, I say you, if that nowadays people are in India, particularly in India, just because only for a fame they are going. Okay, the fame or with by a reference they are going and they are doing some ergonomic presentation. Okay, they are coming back only by without any remuneration, even without remuneration. This is one type. Some person may get remuneration if to a basic amount. Okay, this is one type which we can deal with the ergonomic. Okay, and another corporate. And the next thing how we can go is this thing which I said earlier, this presentation and all, we can go only with the reference. Okay, and if we call there are many procedures there how to go collaborate with the corporate. So if we are going like this means, that is a one day type, and they won't pay much amount. Okay, so because if number of population is there, nowadays corporate or trying to keep a physiotherapist or something, physiotherapy clinic is there even within that corporate sector. Okay, so they are dealing any sort of thing ergonomic issues with those person. Okay, if this person, if we are going secondly, apart from this workshop and along apart from that clinical setup, if we are going to do some analysis, workplace analysis means, there are two different ways are there. One is a audit base, ergonomic audit will happen, that is totally different. Okay, another thing, is there. If a company want to see in Jaipur, I went for a new branch, my husband company, and I went as an ergonomist to set up a IT setup. A new IT setup was building was new. And what kind of ergonomic chair they want my ergonomic advice. As an ergonomic advice, they ask me what kind of chair, where to put a light setting, where to keep a light underneath the chair or something, okay, or behind. So with my advice, they I created everything analysis. This is okay, completely good. But we cannot, if the company is already set up, okay, already is in full form, people 1,000 6,000 people are working, means we can, if we give this chair is old, that chair is old, this table is old, this is not ergonomic fit table, if they are, if you're keeping this, will produce a neck problem. So you have to change, mean that will go for a complete loss for a company. Even if you are shouting like your profit is depend upon the workers health. Even if we are shouting, they will replace the that staff. Okay, that is the old outdated ergonomics. So what we can do is, we can give, even if a corporate cannot change the entire workstation, we can give a remedy for them by keeping a footstool, or we can keep any cushion underneath the chair. Okay, and we can keep anything, any whatever the edit, even small. That is in Tamil, there is a saying, tirumbum palkutta udavum, like that. There is a small things which we can utilize, and we can change, look for a gross change to, without producing more economic investment. Okay, so we have to go and advise like that. Okay, even if you're creating a good ergonomic setup, we have to make them ensure that how to sit, how to utilize that environment properly. Okay, this is about the environmental component of posture ergonomics. These are all the four components that under the posture ergonomics. One is a functional component, and second is the structure postural component, and third is the brain based component, and fifth is the environment. All these component, wherever setup you are going, either for a manufacturing setup, or for a IT setup, or even for a homemaker, or a pregnant woman, any, for any people, wherever you are going, you have to include all these four, the four component of posture ergonomics or ergonomics. If you miss out to rule any dysfunction over this four things, okay, you cannot get a complete solution for a pain or discomfort for a person. Okay, and this is about that posture component. And there are new emerging ergonomic terminology are coming, like visual ergonomics. Of course, visual ergonomics is there, and voice ergonomics is there. Voice in sense, for teacher, if you are dealing the instrument, wherever a person we are doing, if it is a teacher, means voice is a primary instrument. So we have to concern about the voice along with that musculoskeletal or physical ergonomics. Even that musculoskeletal comes under the physical ergonomics. So visual ergonomics is there, voice ergonomic, that is audio, that is vestibular ergonomics. It's otherwise called acoustic ergonomics. Okay, so physical ergonomics and many more thing is there. Environmental thing, neuroergonomics, cognitive ergonomics separately is there. So many types of ergonomics, emerging ergonomic terms are there in that postural ergonomics. So it will take separate goes as a wide, and we can speak more about that. And even for a worker, if she or he or she is a female, of course we should not confine only with this movement and functional anything. We have to look for the hormone also, because hormone plays a major role even in the motor homunculus, motor thing. So for example, the neuromuscular junction activity and muscle strength is also depends on the estrogen of a female. So whenever in over the menstrual cycle, whenever the estrogen component, that is in case of ovulation period, after ovulation period and all, that is so follicular, late phase or follicular phase, and all that, estrogen will be more, so woman will be active over that follicular phase. And over the luteal phase, mid of luteal phase and all, estrogen will be good amount of estrogen will be there, so a person will be active. What happened in late luteal phase, the woman will go for laxity. Same as we say in pregnancy, even for a normal menstrual every month menstrual cycle, there is for a woman there is a postural weakness, fatigability, muscle strength weakness, everything is there. So how we can give a training session for the in relates to that hormone for a worker, for a household environment. There are lot of things there. If we go to the hormonal ergonomics and organ, even see if a person is sitting for a long time, have you ever noticed that diabetes is not only happen because of this hormonal thing, but of course hormonal thing, and also it happens that hormonal issues happen, may happen because of this postural discomfort. So if a person is all the way keeping like this, means with forwarded posture, means thyroid is here laryngeal muscle like stylohyoid muscles and omohyoid muscle goes for tightness, so it will pull the thyroid forward, it will lead to a dysfunction. As the thyroid position is moving anteriorly, thyroid gland position is moving anteriorly, it will inhibit the production and function of thyroid. So ultimately our whole hormone system is collapsing. Also if a person is doing like this with forward posture, intestinal peristaltic movement is getting inhibited. So what happened is, next to that small intestine is the pancreas is there. So if a pancreas is going for inhibition, it leads to a insulin production dysfunction. So a person is going for a type 2 diabetes mellitus. So posture assessment and everything, we have to go all the way these three, starting from the menstrual, hormonal, this diabetic, everything we have to do as a, we have to see a human as a whole when we are dealing as a physiotherapist and as an ergonomist and anything. Okay, we have to see as a whole in the sense musculoskeletal system, hormones, organs, everything as a whole. Only if we give a solution as a whole, we can get a solution as a whole. When we assess body as a whole, we can get a good solution as a whole. So this is about posture ergonomics dealing. Okay, next time if we get a chance, we can see separately about different types of ergonomics and different workplace and many things is there under ergonomics. Lot of things is there. It's a very interesting topic actually for me, and I'm dealing with this ergonomic since my college, PG post graduation time. I understood by the time that whatever, if a person, as I am into assessment and all, I understood all the discomfort coming is because of activity. So I done my PG thesis under that ergonomic, cardiovascular ergonomics. So there is cardiovascular ergonomics is there, that is a very good topic actually to say. And so I dealt with that, and I understood every problem for a human is an ergonomic problem. Every problem or discomfort, pain is an ergonomic pain. So every pain happen because of the activity, either that activity may be hyperactivity or a sedentary activity. That's it about our whole body as a whole. So I finish it by here, and hand over the session to Dr. Himanshu sir, Himanshu Mathur sir.
Yeah. Hello, ma'am. Thank you so much. That was really a wonderful insight to the postural ergonomics to everybody. And in fact, I would also say you also included a new domain to people where people can work, actually being physiotherapists. So I would request, if anybody has any question, they can write it in the comment box, or also they can directly contact to ma'am through various social medias or via email if they have any questions. And also, if they want to learn more from ma'am, they can also contact either us or directly to ma'am. They can contact. Thank you so much, ma'am. That was really a
Thank you,
wonderful
sir.
session. And then this gave all of us the basic physiology behind the postural maintenance, and at the same time what we should do, what we should not do, and of course a new domain for physiotherapy. Thanks a lot, ma'am. We're looking
Thank you,
forward to
sir.
like this in future from you. Thank you.
Sure, sir. Sure, sir. I'm very much happy. Thank you to you, and thanks to Jaipur Physiotherapy Network, and special thanks to Adil Singh sir and everyone. And so Jaipur is for me. Jaipur is a second hometown actually where I work. So I'm always thankful who accepted me. Okay, initially. So thank you all. Thank you all, sir. Thank you, sir. Bye bye.
Bye bye. Thank you, ma'am.
Bye.